Well, good afternoon, everybody. Welcome to our monthly Community Mental Health Transformation webinar. I'm Megan G and I'm the Communications Manager for the programme. If you've joined the webinars before, you will have seen me many times as we've been running these sessions for the last couple of years now. And today we're going to be taking a more in-depth look at the current progress within Brighton Hove. So we've visited West Sussex and East Sussex in previous sessions. So today we're really focusing on Brighton and Hove. So welcome to you all. Before we get started, just going to do a little bit of housekeeping just to make sure that everybody's comfortable and can obviously access the session in the best way for them. So the session today is being recorded. So if you have got colleagues who have been unable to tune in live, then there will be a recording available. So please obviously share that with your colleagues, friends, anyone who's interested within the programme. And because the session is being recorded today and will be made publicly available, do by all means feel free to keep your camera off. If you want to anonymise your name, please feel free to do so. But equally, obviously, you're very welcome and encouraged to participate in the session however you feel most comfortable to today. If you want to turn on live captions, you can do so by clicking the three dots on your screen that says More, which is in the toolbar of your screen. And if you go to Language and Speech, you can then turn on live captions if that's helpful. We've got approximately 25 minutes worth of presentation today, and then the rest of the session will be focusing on giving an opportunity for you to ask any questions that you've got of our presenters today. So you can do that in a couple of ways. You can pop your questions in the Q&A box, which I'll be keeping an eye on throughout the session, or you can pop questions in the chat and I'll be responding to those as we go. Or when we come to the Q&A, you can raise your hand and you can unmute and ask the question yourself. So whichever way you want to do it, there's lots of options available to you. And then lastly, after the session today, everyone who's registered, I will email you with a copy of the slides and a link to the recorded webinar. So if you want to watch it back, you can, or if you want to share it, obviously, please do. Within that email, there'll also be a link to a very short survey, which I'd really appreciate if you could complete, because it just helps us to make sure that the content we're providing within these sessions is still helpful for you, and also gives the opportunity for you to make any suggestions about things that we could do differently or topics that might be particularly helpful for us to cover in the future. So if you do get the opportunity to do that, please do. And then lastly, as I say, we've been doing these webinars for a few years now. So if you are new to the transformation programme, we've got a whole back catalogue of these webinars since 2022. And you can access those on YouTube either by scanning the QR code on the screen, or I'll also include the link in the email I send round. So that's a really good place to go to if you want to see what has happened before and where we are now. So that's it from me in terms of housekeeping. I'm now going to hand over to our presenters. So today I'm joined by Brooke Joyce, Juliet Couche and Layla Morley. Did you want to introduce yourselves? Thank you.
Hi everyone, so I'm Brooke Joyce. I'm the Partnership Lead for UK Brighton and Hove, and I work for Southdown, who are the lead provider.
And I'm Juliet Couche. Hello everybody, and I'm a consultant psychologist and the interim clinical director for Sussex Partnership for the Brighton and Hove area.
Hi everyone, I'm Layla Morley. I'm a Senior Commissioning Manager for Mental Health covering Brighton and Hove, and I work for NHS Sussex, and this is one of my key programmes of work that I work on. So lovely to meet you all today.
Thank you all, and I think Layla is starting our presentation today, so I will hand over to you. Thank you, Layla.
Thanks, Megan. So just a bit of background for everyone today. Apologies for those of you that might have heard a lot about the programme today, but just a quick recap for those of you that might be new. So the programme really has come about from national guidance that's come out looking at improving our community adult mental health services. And the reason why we want to make these changes is really that we've seen an increase in the mental health need within our local communities, which means obviously an increased demand on the services that we have. And what we recognise is that the current offer that we have within Brighton and Hove and more broadly within Sussex really has some challenges. So people find it difficult to navigate the different options around support for mental health, so find it difficult to find that support and get access to it. There's often long waiting lists to get support. People find that they might bounce around the system, if you like, so you may get referred to one place and then back to another place, and it might be really difficult to sort of get support from the right place the first time that you need it. And we also know that for staff, that's really challenging as well. So we know that staff, there's a lot of administrative burden that comes with that, but also staff really struggle to have that access to the advice and guidance from other colleagues within the system who may have specialties in different areas. So what we're looking to do with this programme is really make the system much more joined up to work better both for service users and also for staff, so that you'll have a more seamless access to mental health support, and staff will also have more contact with their colleagues in the system to be able to provide that support too. So the programme is very much focused on developing those strong sort of partnerships working, rather than thinking about additional investment. It's about how we utilise what we currently have in a much smarter way. And you can see down the bottom in the purple box, these are our 4 sort of principles that we're using for this programme. So we want to make sure care is personalised to the individual and that it's complete. So it thinks about people as a whole person. So think about all the different needs that you might have. We want it to be seamless and simple in terms of how you access that support, and accessible and inclusive, so everyone can access, and there's no sort of exclusions around that. And we want to have that one team ethos, so really about bringing partners together to provide that support for people. Next slide, Megan. So there's a number of different ways you can get involved in the programme. It's a collaborative programme and approach that we've taken. So we're really working closely with all of our partner organisations that provide support in Brighton and Hove, but also most importantly working with service users and carers around making sure that what we do in the programme really reflects the needs of those individuals. So there's a few different groups that we have running. We have a community transformation partnership group, which is really a group for different agencies to join who provide mental health support across Brighton and Hove. So you can get involved with that group. It meets actually bi-monthly now on Teams, and it's really about that group of people being able to feed into the work that we're doing on the programme, but also to hear updates on what's happening specifically for Brighton and Hove. We have a really fantastic lived experience advisory group in Brighton, which is run by our colleagues and Possibility people. So that group meets monthly, and again is just really a important mechanism for us to link in with existing and previous service users and carers to hear about their experiences and the plans that we have with this programme, to make sure we've got that connect and that we're making changes that work for people. And then we've got a broader voluntary sector mental health network. So that's specifically for colleagues who work in the charitable sector, and it's much broader than just this programme. So it's thinking about mental health across Sussex and all the different transformation programmes that are happening within that space. But obviously this programme forms part of that. So there's a few different ways that people can get involved. And if you're interested in joining any of those groups, obviously, please do get in touch. We're happy to put people in touch with the right places for those. Go to the next slide, please, Megan. So as you'll see and probably gather from what I've said so far, it's a really big programme of work that we're doing at the moment, and we have been doing over the last few years. And this is our roadmap really for implementing what we're calling neighbourhood mental health teams. So that's a fairly new part of the programme that we're looking at implementing currently. We've been really working on this sort of this year, particularly focused this year on implementing those new teams. So you can see we've gone on a bit of a journey. Where we are at the moment is really about to go live with those new neighbourhood teams at the end of this month. And when I say go live, it's very much a soft launch. So what's happening with this programme is it's not a big sudden big bang change when we go live with a new service. it's going to be an evolving piece of work that takes place over the next 6 months in reality. So we're making changes gradually with the existing teams that we have in Brighton and Hove. So you might start to hear about the changes happening from the end of October, but those will continue. And Juliet will talk about that in a bit more detail sort of later on in the presentation. So if you want to go to the next slide, Megan, I think I'm going to hand over to Brooke just to explain a bit more about what the neighbourhood teams are.
Thank you, Layla. So hopefully you will have seen this wonderfully illustrated model diagram on the left already. And if you haven't, ta-da. So this is the new model for the neighbourhood mental health teams, and it's been designed to represent how the teams will work at each level. And as is a new way of working, of course, phase one was really just agreeing what the model was, and involved a great deal of co-production to design and develop what the teams would look like and how they would function. So this included involving people who use mental health services, their families and their carers, service providers and experts by experience. And as you can see, it's 3 layers, and the little triangles show that these layers work in unison, and you can enter, exit and re-enter at any point. And individuals can also move freely within the teams. So whether that's for getting advice, getting support, getting more support, and without having to go back to their GP and get a referral. So everyone is working together. So purely for illustrative purposes, to imagine the client or patient journey, my name is Prabjot. Hello. I'm the lady in the orange scarf at the top. So I'm suffering from anxiety due to a traumatic event that happened 3 years ago. I go to my GP to get support and I'm diagnosed with general anxiety disorder. And my GP then prescribes me some medication and refers me to NHS talking therapies. So I find these sessions really helpful, but after a month they end and I lose a close family member. My anxiety worsens and I go back to the neighbourhood mental health teams for support, and I'm then referred to You OK to put me in touch with Cruz, and I'm offered to apply for a recovery college course about managing my anxiety. A brilliant course, and I promise I'm not biased. So as you can see, people can sort of come in and out as and when they need to. And on the right, you can see more purple circles, and these ones aren't quite as jazzy. And this is who will be in the teams. So we'll have a core team who are forming and working together as we speak to iron out all the details and discover the best ways of working. Then we'll have aligned services outside of that will work closely with the core team. And then as a phased approach, we'll be moving to creating connections with wider networks and partnerships, which will include arts and culture organisations, sports and health, and education and training. Next slide, please. Thank you. So creating the core team, this has been a hugely collaborative effort with multi-agency and lived experience input through the Brighton Hove Operational Delivery Group and Task and Finish Group. So the core team of mobilisation from the 31st of October, which is also Halloween, will be the Emotional Wellbeing Service, Assessment and Treatment Service, ATS, SOAMs, that's Specialist Older Adult Mental Health Services, Access Facilitator Services, Screen and Intervene, Individual Placement Support, IPS, sometimes called Work and Wellbeing, and Primary Care Mental Health Practitioner Service, which is part of the Brighton Hove Wellbeing Service. And as I said, these teams are all coming together at the moment and working out the best ways to work together. Have the next slide, please. So now to the footprints. The footprints basically where these areas are going to be, what they'll be covering, and where they'll be working. And you can see there'll be 3 teams that will be east, west, and north. And we ultimately wanted to create footprints that work with PCM boundaries to ensure that the connections between primary care and mental health services are as seamless as possible. And there's also going to work to align these with the integrated community team boundaries or the ICTs, which is important. So as we know, ATS and SOAMs will be moving from 2 to 3 teams, and some VCSE services will be moving from city-wide working to neighbourhood. And just overall, our key aim with these defined boundaries is to deliver strong alignment between mental health and physical health offers across Brighton and Hove. To Juliet.
Thank you, Brooke. So it is me. So in terms of what is going to be happening from the end of October, I think, as you've seen in the previous slides, this is actually the culmination of a number of years of work to get us to this point. And this is where I think we really feel that we are now in the heat of change really starting to happen. And I know that, Layla, as you correctly referenced, this is a soft launch. We're not going to kind of wake up the next morning and suddenly there's a whole new structure and everything will have changed overnight. This is going to be a gradual process that is rolling out from the end of this month, but a really focused effort in terms of trying to make this whole transition through to our neighbourhood team structure by March next year. So I guess this is really just trying to be clear about what is going to be different from the end of October. So all our neighbourhood mental health teams, all our staff will be aware of the new neighbourhood team footprints through all of the webinars and lots of the comms that is going out, that our wider communities and populations will also be aware of the neighbourhood teams, the new structure. And of course, the 3 footprints that we'll have across Brighton and Hove is a change for many of the organisations that are going to be working in partnership. For us in Sussex Partnership, as many of you will know, we have 2 kind of core mental health teams, and that is going to expand to 3. So there are going to be some shifts and changes, and obviously we are going to want to make this as smooth a transition as we possibly can, working with all of those people that are using our services and obviously staff that are working within them. So we are doing some really detailed planning around that at the moment. I think, as Brooke mentioned, there are, from October, this core team will start to be in place. And I think it's bringing together and integrating a number of different teams that have been working quite separately as silos. So we have emotional wellbeing services that have only been running now for kind of maybe 1 up to 2 years. They're relatively new. They're not everywhere across our PCNs, but they're very much based out in our GP surgeries, working with our primary care teams, and then working very closely with our ATS teams as well. So they will be very much the foundation of the neighbourhood mental health team, bringing in our assessment treatment services and also our older adult services as well. And I think, as Brooke mentioned, the other elements that will integrate being access facilitators, screen and intervene, and the employment service. We also have, as some of you will know, the primary care mental health practitioners that are part of the Brighton Wellbeing Service with the Talking Therapies team. And they, from October through to March, will start to separate and merge in with the emotional wellbeing service part, emotional wellbeing part of the service, rather. So the core team is forming at the moment. There is a lot of work that has been done mapping all of the different members of staff, thinking about how we're going to properly align our staffing to the population needs of each of those PCNs, and to really support staff to make those moves, but also absolutely for all of those using our services and carers, so that we can make this as smooth a transition as possible. A core part of this is a new meeting structure that we're going to have in place. And we're not going into the great detail of what these meetings will look like in this presentation today, but it's really an opportunity to look at how we are working much more cohesively within the partnership that has been described in the earlier slides, so that we're really minimising any of the silo working, which I think is what a lot of people can experience on the ground at the moment. You're either open to this service or you're not. Bringing all of these elements into the core is going to help make movement around mental health support far more coordinated and feel much more streamlined. So those meetings will be in place come starting from the end of October and into November. Building on good practice of meetings that work well at the moment, some new meetings coming in so we can really improve and enhance our contact with our primary care colleagues and ensure that we are much better joined up. And then, I guess, just to underline the point about this being a soft transition, thinking about what will remain the same in October, the meeting structures will come in, the understanding of how we'll be mapped into the 3 footprints will come in, but there'll still be the same organisational structure in place. There's still the same standard operating procedures that are in place, but all of this is going to be worked on over this next 6-month period to then move across to a fully established neighbour mental health team. So it's gently, so that we can do this safely and ensure that we're still providing really good care for people by taking our time and getting it right first time. So next slide, please. So why are we doing this? The fundamental question, what is it that is going to be different? What is it that's going to be better? From a service user, families and carers perspective, well, this is about trying to, and I think, you know, Layla touched on this a bit earlier, this is trying to really simplify how people can access support, clear entry points, easy access, rather than having to have an expert knowledge in how to navigate services, which I know is how it can feel for a lot of people at the moment. By cutting down the number of silos that we have and making it much easier to come in through a neighbourhood mental team, we would hope that we'd see a reduced waiting time for support. So rather than having to wait to see if you'll be accepted by one service or another, that part should be removed as we have much more streamlined integration between different parts of different services as they come together. Fundamentally, this is about a basis on need rather than something or services that are designed around a specific diagnosis. So again, it's enabling us to have more flexibility around that. And I've already, I guess, talked about the kind of the easier transfers that we're putting in place between services, rather than what might seem like a cold referral and then waiting as to whether somebody is accepted into a certain service or not. This is really working to absolutely minimise that. Physical health checks will be part of this core team offer, and obviously all the way through we've been working in partnership with BCSE, with our primary care colleagues to ensure that we have a really good suite of offers in terms of what best meets somebody's mental health need. And I think the other thing that's really important to consider about this is a real move towards how we make the best of treatment interventions and how we are ensuring that we are providing treatments that are evidence-based, depending on the need of that person who's presenting into services. So it should feel different as we move forward and progress this. I think, as Layla said, though, we have to be realistic. There isn't a huge amount of money that's coming down the line for this, but by thinking of working differently, by really focusing on what we can provide in terms of occupational therapy, voluntary sector offers, psychological interventions, how we can actually build a package of care more effectively around a person. And I guess the other side of the flip side of the coin is around staff. And how we are supporting staff to move into this new neighbourhood team structure, but also how we are supporting staff to really work within their professions. So I think, you know, things have become a little bit more generalised over the last few years, and this comes back to a real focus on supporting staff to be delivering what they are trained to do and to really effectively use their expertise. So we'll be really setting up the clinical model to provide the right sort of care depending on what that person's individual need is, and to have access to the staff that are most appropriately trained. So again, by working this way, we're looking to kind of reduce time that's spent on admin tasks, what can become an industry in itself around referrals and trying to sort of find the best fit for somebody. This process, this NMHT, will hopefully really try to minimise that, and it means we are freeing up as much time as possible to support the delivery of direct therapeutic interventions. So it's system-wide, it feels like an ambitious process that we're undertaking, but this is absolutely you know, what we want to be doing to improve the experience for staff working in services, to be able to provide the best that they can, and for those that are using our services, their families and carers, in order to have a much better kind of clearly defined, easily accessible package of care. So I think that's it for my slides. Megan, is it?
It is. Thank you, Julia, and thank you, Layla and Brooke as well. We're now coming to the question and answer portion of our session today. And thank you to those who've already started putting questions into the Q&A box, into the chat. What I'll do is I'll start off just by reading those out. And then if you do have a question you wanted to ask to our presenters today, then please feel free to obviously raise your hand or add it to the Q&A box. And we'll try and get through obviously as many as we can within the session. So the first question here is the neighbourhood mental health team that you're kind of assigned to, will it be dictated by your home address or by which GP practice you're registered with?
Do you want me to jump in, Megan, as I think I've answered the
Thank
question in the
you.
chat? So
Thank you,
hopefully,
Layla.
Juliet and Brooke, you're happy with what I've put in the chat. So I think basically, because we want to focus on making sure the connection between primary care, so your GP practice, and your neighbourhood mental health team is a really good connection, it will be based on where you're registered with your GP practice. So hopefully you're registered with your closest GP practice to where you live, but where that isn't the case and someone may be registered with a practice that they don't live physically near, there will have to be a sort of pragmatic conversation about actually which neighbourhood team would support that you best, because I guess while we want to keep the connection with your GP practice really close by having just one team that your GP needs to liaise with, we recognise that obviously we want to keep service offers and support for people local to you. So if you happen to have a GP practice that you're registered with on the other side of the city to where you live, it might make more sense to be supported by the neighbourhood team in the area where you physically live, because you'll then be connected with local services within that area of the city, and hopefully that will reduce you having to travel across the city to get access to support. But I think we're going to have to take sort of pragmatic decisions on an individual basis where there are those sort of complexities, but generally yes, it will be the practice you're registered with. Hopefully that makes sense.
Thank you, Layla. That's really helpful. We've had another question in the chat here. So speaking as a carer, within the new model and the new framework, will it be possible to have kind of one person that you can contact who will kind of help you, I guess, kind of navigate the services and support, that kind of that central point of contact for the person that's receiving support or for their loved one? Do
you want me to take this one? So it's a good question. And in part, this is still what we're working through at the moment. You might be familiar with the care plan approach that we have currently, where we have lead practitioners within our services. There are going to be some changes to that, but that is all in process at the moment. And there are alternative key worker roles that we are looking at, which we're looking to sort of develop. And again, that all of this work to be co-developed and co-produced with service users, family and carers, because I think one of the kind of, I know it's always a key ask to have a kind of a key point of contact where you want to be able to get support and information, but I think it's also in the way that the model is developed around the neighbourhood mental health team, it's also minimising the need to kind of find one person to think of your, to go to for all of those answers, because the package of care should be much more clearly described, and then a key worker that will support you from maybe one intervention to another. But that lead practitioner role through the care planning approach is all being reviewed at the moment, because we certainly want to be able to still provide a means for people to be making contact, or how is it that we navigate understanding someone's care and continuity of care. And I think one of the other principles that's quite interesting in this context is around the trusted assessor model. So that idea of moving around and meeting different people and having to repeat assessments, actually as a neighbourhood, how we develop a trusted assessor model where your information, your story, you're not having to repeat it again and again in order to be able to access care. Having the neighbourhood coming in around the individual rather than the individual having to move from silo to silo, it all seeks to minimise that, but also still maintaining that key worker focus where we can.
Thank you, Juliet. We've had another question, which I can see Layla has responded to, but I wondered if you'd be able to also respond to the kind of the webinar more widely, because I think it's probably a question a lot of people have got. And that question is, will each neighbourhood mental health team have a central hub office or location that they'll work out of, or will they be located in a particular GP surgery? How does that kind of work? If you wouldn't mind responding, Layla, as I think you've already responded to the question. Thank you.
Yeah, it's fine. So I think in reality, we will be using our existing estates, especially from the 31st of October, given that's only a couple of weeks away. So staff will continue to work from their existing bases in reality. I think what we're going to be doing between now and March is really looking at our existing estates across Brighton and Hove and thinking about where there are opportunities to co-locate staff and to help support that joint working that we've talked about with the neighbourhood teams. So at the moment, we have some staff who are embedded in GP practices and working from those sites. Obviously, other staff work from more central sort of offices, so it will still be a bit of a mixture. I guess what's important for the neighbourhood mental health team model just to be aware of is there won't be, I guess, there's not additional funding to be able to have a nice new shiny building in each of the neighbourhoods. So we will have to be, again, practical about what we can offer, but I think we really want to make sure that we can support that co-location of staff to enable that joint working to happen wherever we can. And I guess it's just recognising that for service users, something we need to give a bit of more consideration to over the next 6 months is in terms of sort of where people access support physically, so physical locations where service users may attend. So we do have some sort of wellbeing hubs, for example, in the city. So it'll be looking at sort of options around how we utilise those spaces, because they're really important sort of spaces for individuals to be able to attend to get support. So I guess there's also that consideration we want to look at over the next 6 months, and recognising that one location may not work for everybody within a neighbourhood. So there will need to be, again, those sort of practical considerations about actually what works for each individual and how they access support. It may be that they want to attend their GP practice for appointments. They may want to go to, like I said, a community hub kind of space. So I think we have to have that flexibility as well to be able to support people in the way that makes the most sense for them. Hopefully that answers the question. I don't know if see Michael's hand's gone up, and I don't know if that's in response to what I've said or a different point.
Did you want to come in, Michael?
Thanks for inviting that. Yes and no. I'm quite happy to wait while we finish this line of discussion off, and then pop in at a more appropriate moment.
No, that's fine. I think that's probably answered the question. So if you wanted to come in with your question, Michael, then yeah, please do.
Hello, everyone. First of all, let me just introduce myself and underline I'm not a medical professional, and so my questions will be very lay and intending to engage rather than go inform. So my background is I'm part of Isabel Clark's Digital and Data Board, and I'm also with my PPG, which is Brighton Health and Wellbeing, and I represent older people in Brighton and Hove. So I think by that last piece, you're kind of getting an understanding of where I would like to sort of focus on for a moment. Thinking about the way that everything has been skewed so far, I get a very strong impression that there is a clear understanding and definition of what services and conditions are being addressed in this strategy stroke policy definition. People tend to be a little bit more general in their relationship with mental health. and I'm thinking here particularly of issues around Alzheimer's, mental services, which, you know, yes, if we had a great ability to address our mental health and the way that it impacts us, it would be great. But quite often in our day-to-day lives, it's not always going to be as clear cut. So I may well be experiencing confusion or displaying confusion, inability to relate to the situation in which I find myself. And it's really difficult. We look upon Brighton Hove as being a city which is Alzheimer's friendly. And yet most of us, if we were confronted by that situation, someone experiencing those kind of issues, it's really difficult to understand and recognize what we're being presented with. So there is a clear, I think, point where day-to-day life flicks over into intervention and being able to find the right door to knock on and go, you know what, something's wrong. How do I address that? It's we don't have those words that make us feel comfortable about the way that we talk about it to each other. This also feeds into the discussion about VCSE and the way that voluntary organisations are struggling, wrestling with the ideas that mental health has. I've been part of the possibility group, so I'm well acquainted with some of the discussions that are going on there. It's not really a good question now, I'm afraid. Help.
Do you want me to come in and try and sort of maybe
Please.
answer some of the things that you suggested? And I don't know, Juliet, Brooke, obviously do jump in if there's things you want to say. I guess there's a few different things I think that came up for me with what you were saying, Michael. And I think one of them, I guess, is around sort of how you get access to support when you need it. And I think what you're saying, hopefully I'm right, is that sometimes it's not always clear cut. And I guess the point with this model, hopefully, is that there will be multiple ways of accessing the neighbourhood team. So what we call like a no wrong front door approach. So essentially, if you're getting support from your GP or from a voluntary sector organisation, and it's felt that actually the neighbourhood mental health team could support you with whatever your needs are, that they will be able to connect you with that team. So there's not a single kind of access route, if you know what I mean, that you have to go through and you have to tick certain boxes and meet certain criteria. It's going to be much more flexible than that. And I guess the other thing, just sort of touching on the stuff you were saying around different things that people might need support with, and I guess the other thing we want to do with this model is look at the wider system in terms of, you know, what support people need in their day-to-day lives to maintain well-being. So it's much broader, I guess, than just traditionally what we might think about in terms of mental health and sort of clinical interventions, if you like. We also want to bring in some of that community aspects around sort of actually, it might be that someone's struggling with debt or housing issues or loneliness and isolation, and actually we know those things are really impact on people's mental health. So actually it's making connections with those types of offers within the city as well, so that people have a much broader sort of wraparound support around them, in addition to all of those clinical support and interventions that we sort of traditionally would provide someone with. So I hope that sort of makes sense. And I guess I know you were referring to sort of dementia and memory and Alzheimer's in particular. So you would have seen on the slides that obviously the specialist older adult mental health team will be part of this neighbourhood mental health team, and they do have an aspect of supporting sort of specialist dementia needs. So particularly when you're thinking about someone who has dementia and sort of a mental health need, so that kind of comorbidity, if that makes sense, the two things happening at once. So there will be specialists, I guess, within the neighbourhood mental health team, thinking particularly about the needs of older adults and thinking about memory as well. But obviously there will be sort of where there is a bit of a blurred line between whether someone has a memory problem or not, and that kind of, as you were saying, that whether someone hasn't received a diagnosis, for example, and that needs to be done, that will still sit within sort of the memory assessment teams that we have currently. So there will need to be a really good connection with those teams as well. Hopefully that helps answer some of your questions, but I don't know if Juliet or Brooke want to come in if there's anything else I think would be useful to share.
I think you covered it quite well, Layla, and I think it is, if I'm kind of picking up your points correctly, Michael, that actually sometimes if it is, it's not always easy communicating the needs that you might have. And I guess picking up on the point that you're making, Layla, of this principle of no wrong front door, that actually whoever you're engaged with, whichever organizations you're working with, it provides some sort of line into support. So that idea of that we're a much more joined up community of services all working in partnership, which means you're not having to say just go through a GP front door route. So I think this model brings a lot more flexibility and therefore should be much easier to access, not just necessarily for mental health needs, as you say, Layla, but the wider sort of, it's that sort of biopsychosocial approach, isn't it, that in terms of what our social needs might be or what our physical health needs might be, and how we're sort of better joined up and think about our care holistically, and how as a kind of as a I can't think of the right word, but it's as a community of physical and mental health care services, we're working together much more effectively.
Thank you. Michael, does that respond?
I think it's a good step in the right direction. Obviously, one of the things that kind of plays in the back of my mind is that I've seen a couple of really good training sessions around Alzheimer's this year. Back in June, there was a couple of one at Shoreham Harbour and one at Tower Gates. Really interesting stuff designed to inform people, because quite often we don't have the equipment that allows us, you get this feeling in the back of your mind, this is something's not right here, and you can't put a name to it, you can't put a word to it, and you don't want to bother your GP about it, and you think, what's going on here? And it just, you get to a point where a crisis develops and you need to push through that and reach out for help, and that's a difficult thing, especially if you're an older person. It's not something that a lot of people feel comfortable, they don't want to bother, so I think there needs to be a lot more raising awareness of what help can be offered and when it needs to be asked for. There was a great series, at least the second time I've been aware of it, Aging Well Festival this year, and a whole day conference, again twice this second time this year, in Brighton Hove, around older people and some of the ways that they're challenged by becoming that. It's not all sort of the golden sort of age that we're kind of encouraged to believe is going to be there towards the end of our lives, but it is something that is going to happen if you're lucky enough to live that long. Sorry, more rambling.
No, not at all. Layla, did you want to come in on that point?
I was just going to say, actually, I don't know, Megan, it's kind of almost pointing it to you, so forgive me, putting you on the spot. I was thinking actually what Michael's saying, and I wonder if it's actually there's something about the work that the comms, the communications working group are doing, and actually whether it's worth mentioning some of that, because I think there's something around that sort of consistent messaging, isn't there, and being able to access information around sort of mental health that maybe that might sort of answer some of Michael's sort of thoughts. I don't know if you wanted to say anything about that.
Yeah, no, that's a really good shout. So over the last few months, there's been a group that's been formed, which has got partners from all throughout Sussex in different organisations that provide services and support, as well as people with lived experience of accessing services and families and carers. And what we've been doing is trying to simplify the sheer breadth of information that currently exists out there around services and support in Sussex, and the kind of differing information that you can get. So what we've developed is some kind of consistent mental health signposting information, which has been shared with partners across Sussex to update their own information that they provide to people when they're seeking information and support, so that hopefully we're all saying the same thing and directing people to the same places. And as a follow on from that, we're also developing a mental health kind of awareness raising campaign, which is going to go out at the end of the year and run through into January. And there's going to be a couple of phases to that campaign. The first one will be very much that kind of general awareness raising about the importance of obviously seeking help for your mental health and what that might look like, the sorts of that you said about that kind of feeling you have in the back of your mind where you don't really know how to describe it, but you know something isn't quite right. So a campaign that can just help people to perhaps question that feeling and know that it's okay to kind of seek more information and support. And as a second phase of that campaign, we're going to be looking at specific groups that would benefit from having kind of a more like targeted approach to a campaign that speaks directly to their needs and the sorts of things they might be experiencing or feeling. And one of those groups will be older adults and people who are experiencing and perhaps difficulties with memory or concerns around kind of the aging process and how that can impact their mental health. So that's being developed at the moment, and I'd be very happy to put my email address in the chat and link you in with that work if that would be of interest to you, Michael.
I'd be more interested in more engaged method. It's difficult to scrape information from the chat into an email. I'm quite happy to maybe give you my phone number so that we can then exchange contact details.
That's fine.
Not to be too pushy.
No, that's fine. What I'll do is after the session, I'll be sending an email around to everyone who registered. So do feel free to obviously respond on that, and we can then pick that up outside of the session.
Great, thank you, Megan.
Thank you. Okay, so we've got sorry, I just muted myself while I was talking. We've got a couple of other questions that's come in. So a question here, which is around kind of the core services that we described, and ask if we can kind of explain what we mean by access facilitators and that service. So who, kind of what do they do, kind of who do they support, kind of what do we mean when we say access facilitators? I'm not sure who wants to come in on that point. Do you want to, Juliet?
I can come in on that. It's not the snappiest of job title, is it, in all honesty? But access facilitators it's a sort of a community support type role. And these are roles that are specifically proactively engaging with people with a serious mental illness to really look after physical health. So they will perform physical health checks, they will look to support people with serious mental illness to access their GP appointments. So it's really focused on the physical health element of somebody's experience, because as we know from so much of the research, those with a serious mental illness are really disadvantaged in terms of their physical health. So these roles have specifically been brought in to proactively work with people who might need that additional support to be attending to their physical health needs. It's an interesting job title, I appreciate, and it's not immediately clear, is it, what it is from that term, access facilitator. But I hope that sort of provides a neat summary.
Thank you, Juliet. That's really helpful. I'm just having a look in the Q&A box. So we've got a question here from Phil, and Brooke has responded. But just for the purpose of others joining the call today, Phil has asked, what will the interactions be with charities, and how will this kind of new way of working help improve the links between kind of charities and kind of the other organisations that we've spoken about today, including how will it help kind of referrals kind of between and into services? Brooke, did you want to come in on that point, as I've seen you responded to Phil in the chat?
Yes, of course, yeah. So this will be more of a phased approach, but I think once a core team are, set up and fully functioning, it will be then aligning those other services in the community. And that could include charities or people delivering mental health support. And then obviously the wider network and partnerships will sit outside of that. And the whole point, I guess, in the mental health team is that everyone's going to be working closer together. And the triage routes are still being worked through, but it just means that people will know about what's available, and the organisations that are aligned or wider networks and partnerships can feed into the triage meetings. So I guess the key point of the mental health teams is that these meetings will be in place for the individual cases to be discussed and for people to pick those up. So if the aligned and wider network partnership services wanted to come to those meetings and pick up referrals from there, then that could happen. So yeah, don't know if that answers your question, Phil, but it's still being worked through basically.
Thank you, Brooke. And obviously within these webinars that we hold and the other communications that we share, we'll obviously keep people updated as things progress. Obviously today we're kind of sharing a picture of kind of where we are now and kind of where we've got to, but obviously as has been described in the session today, there's going to be a lot happening over the coming months. So we'll obviously keep people informed as things kind of progress and evolve. So that you've kind of got the latest picture of how things stand. Just seeing if we've covered all the questions. I can't see any outstanding questions that we haven't already covered. Just checking here as well. Oh, here we go. We've got a new one. That's fine. So a question here from Benjamin saying, will there still be a central referral point and triage team, or will this be segmented into neighbourhood mental health teams? Yeah, so it's that question around kind of how will people refer? Will it be kind of different now?
I didn't know, Layla, whether you wanted to start with that. And I
can start. Yeah, I don't mind. Yeah, and you can chip in. So so from the 31st of October, there's a bit of a now and a later kind of answer to this question. So from the 31st of October, there won't be any changes to existing referral pathways. So essentially, you will be able to refer to the existing services as normal, and they will get to the neighbourhood team where that's appropriate. Going forward, obviously over the next 6 months, we really want to work on streamlining those referral pathways to make that much simpler for people. So I think it's a bit of a work in progress, to be honest, Benjamin. So at the moment, you can continue to refer as normal, and that's the same obviously from a professional or from a service user perspective. If you can self-refer into things like UOK, then that will obviously continue. So there are obviously at the moment there are sort of some central access points already that exist. So obviously Brooke can speak probably a bit more to this. UOK have a central access point for voluntary sector organisations around mental health support for Brighton Hove. So that will continue to be an option at the moment. And the same, obviously, Juliet might want to come in this. There's a central access point, isn't there, for wellbeing services in Sussex Partnership. So those central access points aren't going to change at the moment. But I think what we want to do with the model going forward is really make that much more streamlined. So there is a whole lot of work, I think, Juliet, you could probably speak to this better, in the background going on about how we make sure we do this in a really sensible way. So it will be about how we're keeping that no wrong front door approach, so you can you've got multiple ways of accessing the neighbourhood team, but as you say, there's a single sitting behind that, there'll be a kind of a single point where all of those different referrals are looked at on behalf of the neighbourhood team across sort of organisations, to make sure that basically when someone's referred in, we look at that from a multi-agency perspective to make sure we get that person the right support, no matter which organisation or individual is going to provide that support. So there's a bit complicated. I don't know if I've explained that very well. Juliet, help me.
I think you have explained that. Mel, have you got your hand up? Are you wanting to come in at this point?
Yes, just for exactly what was said. I am also West Sussex Service User Governor, but I'm also a community care ambassador for the ICB, and I can tell you that what is being said in these meetings here, being open and just and oh God, what are we going to do, are actually really, they're not being staged and answered. They are truth and answered, and it is also people with general physical health care wondering how they're going to find some mental health care. It's working in both conjunctions, and it's not being said just for effect. It is the truth the way it's going. So it's actually very, very, what you're hearing is the way it's going.
Are you posing that as a question or as
no,
a
I'm posing it as a backup
statement?
point, and
yeah.
God, hear the good stuff, and actually it is good stuff. We've spoken about this many times in the past, and now you've got people in West Sussex and East Sussex going, they're showing great interest. How is it going in Brighton and Hove? How can we find out? And you've got people who would like to get involved. So you have an open workforce there, and the staff of equal interest, but it's no major shoving over the other and someone's more important. It really is, it's open interest, really is.
And I guess just, again, picking up on what Layla described, I think it's helpful that you say, Mel, this isn't sort of an ambition. This is the direction of travel. This is what is being developed.
It certainly is what's being said and spoken of, and it's not being glossed over. And well, yeah, what we would do is, but it's right. What we're going to look at, what we're going to try to approach, and try to, there's no promises, outrageous promises being made, just to keep everyone happy from different trusts. It's the ICB really, what we're going to do is think about this one and then get together and talk about it again. It's not in your face, shut them up and get them out of the meeting.
No, and as you say, this is why it takes time. It is it's a really complex coming together of different parts of the system. And we don't necessarily sit there with what the obvious answer is, which is why coming together as different partners and working through it all with staff involvement, service user, family carer involvement, organisational involvement, it's a really complex process. But I think we all share that ambition, that's where we want to get to. That is the direction of travel that we're moving towards. So your contribution is helpful, Mel, because I think, yes, it's not a case of, well, we're just going to do it like this, or something that is wildly ambitious that isn't necessarily achievable. I think it's the painstaking detail in trying to turn these ambitions into the reality that we are working through at the moment, and should start to see from the end of this month and into November with the new kind of meeting structures that are coming in, and the formation of the core team and the cultural shift that will be required to bring people to work together in a different way.
It may damn well work. Excuse me, I'm being recorded. I said a bad word, but there you go. My mother will slaughter me. Sorry, Mum.
Thank you, and thank you, Layla and Juliet, as well, for responding to that question, and thank you, Mel, for your obviously encouraging words and support of what we're trying to do here. And
That brings us to a really nice point to close the session today. So I'd just like to thank our presenters for providing us also with an update for Brighton and Hove today, and thank you to everybody who has made the time to be able to attend the session, for your questions and your comments and feedback. As I say, this is a monthly webinar, so next month we'll be back on the 20th of November and we'll be going over to East Sussex for an update from them. But as I say, I will send round the slides and the link to the recording from the session today. So if you do have any further questions which you didn't have the opportunity to ask, or that come to you kind of once the session's ended, do feel free to respond to that email or come through to me.
Will you
And
be
I'm very
sending
happy
round an invite in that email?
An invite to the next webinar.
Yeah, will it be in that email?
That there'll be a link so you can register to
phew.
the next webinar. Yes, yeah, no, I'll make sure that's included. But yes, thank you all so much for your time today, and I hope you have a good afternoon.
You too, and excuse me, stay out of the rain and have cake and coffee instead.
Thank you very much.
Nice
Bye, everybody.
Thank you. Bye-bye.